In this lecture, we're going to look at metabolic syndrome, which is sometimes a little bit of a confusing topic for students because it's not a discrete disease like some of the other things we've learned about in this class, like cancer or diabetes or heart disease. Metabolic syndrome was formerly called Syndrome X. Okay? And a syndrome means it's not a discrete disease, but it's a cluster of risk factors. It's like the thing that increases your risk to get everything else. It increases the risk of things like developing type 2 diabetes and cardiovascular disease. Metabolic syndrome is associated with obesity, poor eating habits, and a sedentary lifestyle, so someone who doesn't exercise on a regular basis. And it's thought that about 20% of the U.S. population suffers from metabolic syndrome. And I'll show you in this lecture in a moment that there's very specific ways to identify who has metabolic syndrome. It's characterized by having an abnormal metabolic profile. It's basically like looking on the inside. When we look at your blood work and your blood sugar and your blood pressure, are those numbers out of whack? That's how we determine if you have metabolic syndrome. Okay, high levels of abdominal body fat, so that central obesity, that visceral fat, okay, that is characterized by people who we sometimes call apple-shaped. Okay, that's a risk factor for metabolic syndrome. And then also insulin resistance. These people might not have full-blown diabetes, but when your weight is higher, when you're fatter, your fat cells increase in both size and in number. As those fat cells increase, it makes the insulin that your pancreas makes less able to do its job. You can kind of think of the fat cells being so big that they're blocking the access to the healthy cells, and when the insulin shows up with your blood sugar, the fat cells are blocking the entrance. Okay, and so your insulin ends up not working as well, and your cells are not as receptive to the insulin as they otherwise would be. And that's why when you lose weight and your fat cells shrink in size, it actually makes your body more insulin sensitive, which is a good thing. The insulin that you make starts to work better. So metabolic syndrome, again, not a specific disease rather, but a cluster of risk factors that increases your risk of things like stroke, heart disease, so together those are cardiovascular disease, as well as type 2 diabetes and insulin resistance. How do we diagnose metabolic syndrome? Okay, a person is said to have metabolic syndrome when they have 3 or more of the following characteristics. So I'm going to show you 5 different metabolic parameters. If 3 of these or more apply to you, then you have metabolic syndrome. If 0 or 1 or 2 apply to you, you do not have metabolic syndrome. The first parameter is looking at abdominal obesity. It's not just the number on the scale that matters, it's how that fat is distributed. And we know that the fatter you are around the middle, the apple-shaped or that visceral fat, that is a risk factor for metabolic syndrome. So in males, anything greater than 40 inches waist circumference is a risk factor for metabolic syndrome, and greater than 35 inches in females. Now, males tend to be more in tune with what their waist circumference is because their pant sizes come in numbers that correlate to the number of inches around their waist. So if your pant size is going up, clearly your waist circumference size is going up. If your waist size is 40 or above, then yes, you're in that danger zone. Females are oftentimes less inclined to know what their waist circumference is because the 35 inches doesn't correlate to our pant size. The way you measure your waist circumference is at the thickest part around, you take a tape measure, and you should just loosely touch the one end with the other end, okay? Not super tight, and it's usually for most people around their belly button is going to be where the thickest part of the waist circumference is. Now that might not be exactly where you wear your pants, so the pants rule for guys doesn't always hold true. Again, 35 inches for females and 40 inches for males. The next parameter after abdominal obesity is triglycerides. Okay? Hypertriglyceridemia means high levels of triglycerides in your blood. Now triglycerides are little globules of fat that float around in your blood, okay, and they elevate your risk profile for heart disease. Although they're fat globules, you might be surprised to know that they're very heavily influenced by 2 things in your diet that are not fat. Okay? One is sugar and the other one is alcohol. Okay? So a diet that increases your triglycerides would be one that has a lot of white foods. The sugar, remember, being in refined carbs, things like white breads and white pasta, even a lot of white rice. Okay? But if you drink a lot of sugary beverages or eat a lot of refined sweets, the sugar in your system actually increases your blood fat, which is your triglycerides. The other factor there is alcohol. We oftentimes see high triglycerides in people who drink a lot of alcohol. So as a result, one of the therapies to help bring down your triglycerides is cut out your alcohol and cut out your sugar. Say if it's white, walk away. Anything with white sugar or refined sugar, anything with white carbs in it. If you replace those foods with whole grains, fruits, and vegetables, and get rid of the alcohol, you can bring your triglycerides down. Okay. If your blood triglycerides are greater than or equal to 150 milligrams per deciliter, on the slide it says TF, that should actually say TG. Okay, TG is the abbreviation for triglycerides. So if you've had your blood work done recently and you look at your cholesterol, there's another number underneath that called your triglycerides. If yours is greater than 150, you should think seriously about cutting back on your alcohol and cutting back on your sugar. But also, if your triglycerides are above 150, that is an indicator that you're a risk factor for the metabolic syndrome. The third parameter is your HDL cholesterol. Remember, your HDL cholesterol is your good one. H for healthy. If the good cholesterol is low, that's not good. We want your good cholesterol high. So for males, if the good cholesterol is less than 40, or for females, if the good cholesterol is less than 50, that's considered to be a risk factor for the metabolic syndrome. The fourth parameter is your blood pressure. Blood pressure greater than 130/85 is considered to be a risk factor. We've learned in the course elsewhere, and perhaps you've seen in some of the guidelines, that blood pressure of greater than 120/80 is considered high. For the sake of metabolic syndrome, there's a little bit of a cushion there. Anything over 130/85 is considered to be high. And then the last one is your fasting blood glucose, so your fasting blood sugar. This is after you fast for 8 hours. If your blood sugar is above 100, that's a risk factor for metabolic syndrome. You might also know that having a fasting blood sugar above 100 is also the grounds for diagnosing prediabetes. If your fasting blood sugar is 100 to 125 milligrams per deciliter, that's prediabetes. And we know that prediabetes is like a red flag for, hey, you better make some changes or you're going to get full-blown diabetes. Full-blown diabetes is a fasting blood sugar of greater than or equal to 126 milligrams per deciliter. So either if you had a fasting blood sugar of 140 or 102, with regards to helping to diagnose metabolic syndrome, anything above 100 is considered to be a risk factor. So let's say we have a man, okay, and I'll give you a couple examples here. Let's say we have a man, okay, and his waist circumference is 38 inches. His triglycerides are 185. His HDL is 38. His blood pressure is 120/80. And he's got a blood glucose of 101. Okay, I'll say those parameters again, and you can write them down. And then the question is going to be, does he have metabolic syndrome or not? He's a male. He's got a waist circumference of 38 inches, triglycerides at 185, an HDL of 38, blood pressure 120/80, and his blood sugar is 101. Does he have metabolic syndrome, yes or no? The answer is yes, because he has 3 of the parameters. And the parameters that define him as having metabolic syndrome, first and foremost, is his triglyceride levels, which are 185. Secondly, it's his, he does not have metabolic syndrome. I made it too hard for myself. Because he only has 2 of the parameters. Okay?
He's got 3.
He's got 3. What's the third one?
HDL's less than
The
40.
HDL is less than 40. That's right. He does have 3. Okay. So his triglycerides are 185, his HDL is 38, and his blood sugar is 101. So he has 3 or more. Yes, he has metabolic syndrome. So if he went to a practitioner who was looking out for these risk factors, he would say, listen, you have this thing called metabolic syndrome. And the patient would say, well, what does that mean? Well, that means you've got these risk factors that you don't just have one thing wrong with you. You've got a couple things that metabolically are increasing your risk across the board for a number of different chronic diseases. So the recommendations that he would make first for his triglycerides, decrease the sugars in your diet, including the white carbs, and decrease the alcohol. And if you drink alcohol, the recommendation is just stop drinking it. It's the quickest way to bring your triglycerides down. For his HDL, there's not a whole lot you can do to bump your HDL up, okay? But things that can help increase your HDL is to do regular physical activity, regular exercise. Okay, especially cardio helps bring up your HDL. Now, it's just a couple of points, but in his case, that would help. He's at 38, and he should be above 40. The other thing that also does help increase HDL is regular moderate alcohol intake, but that's contraindicated in this case because with his triglycerides, he shouldn't have any alcohol. So we wouldn't want to say, hey, drink more alcohol to get your HDL up. We would just avoid the alcohol recommendation and have him focus on exercise. And then lastly is blood sugar. Okay, if his blood sugar is elevated, now 101, that's not really that high. It's just a tick over the 100 level. Okay, but if it's consistently above 100, if he's overweight, which he probably is, we don't know how tall he is, but a waist circumference of 38, that's pretty high for most men. If he lost weight, his sugar would go down essentially because his insulin sensitivity would improve. Okay, so that's an example of how you diagnose metabolic syndrome. Again, you need 3 or more of those characteristics. Okay. A couple of other things related to metabolic syndrome. Okay. If people have elevated insulin levels, okay, it overcomes their body's ability to resist or to accept insulin, and they end up getting what's called insulin resistance. Okay. So insulin resistance is just kind of tied into the elevated blood sugar levels, and weight loss helps with that in many people. Okay, some of the adverse effects associated with metabolic syndrome. Okay, it stimulates your kidneys to return sodium to your blood, which further raises your blood pressure. Of course, high blood pressure raises your risk of stroke. Okay, in females, ovaries actually experience increased testosterone production, which can disrupt menstruation and fertility. So some women who find themselves with difficulties conceiving, okay, especially if they're overweight, the metabolic syndrome, if they meet the other parameters, could be impeding their ability to get pregnant. We know that both being overweight and underweight decreases the chances of fertility. And then metabolic syndrome also increases your blood lipid levels, so your cholesterol and your triglycerides, which leads to heart disease. The type of fat patterning that you have is kind of the biggest clue about metabolic syndrome. Remember, the waist circumference is the first thing we look at, and if that fat is around the middle, the apple-shaped, that greatly increases your risk of having metabolic syndrome and other related conditions. Okay, the pear-shaped fat patterning that you see in usually premenopausal women, where you carry more of your fat around your hips and your butt, okay, that type of fat is not as metabolically active and it's not as dangerous. People with that pear-shaped fat patterning are going to be less likely to have metabolic syndrome and some of the other related chronic diseases. And lastly, if you're looking for more information, if you're curious as to whether you have metabolic syndrome or what can be done or what sort of research is out there supporting the different therapies to help treat this, I recommend you look at these 2 websites from the National Institutes of Health and then also from the National Library of Medicine in the Medline Plus page.